Welcome back. This is the fourth lecture in psychopathology. We left off in lecture 3 with the dissociative disorders, and we will continue now with the body dysmorphic syndrome. So when your view of your body is different than reality, it can mess with your head. A person can have body dysmorphic disorder, which means they see something wrong with their bodies and are obsessive and compulsive about the issue. However, there is truly nothing wrong other than their image of their body. In my PowerPoint, I have a link to a great YouTube video, which does not appear in this slide, just a big X like an envelope. But I will add a link to click on when I load this slide to YouTube, so you'll be able to get to that. Advertising and marketing companies continue to present models as reality, when in fact the pictures have been perfected with Photoshop or some other software, and no one looks like the pictures, and no one ever can be that level of perfection. In this slide, we see how body image shapes your behavior. The man at the top has a great weight, but sees himself as fat. This body image causes him to reduce his weight and then leads to anorexia, which we'll cover in a couple of minutes. The picture of the man on the bottom left shows a man who has good muscle tone, but he sees himself as non-muscular and therefore forces himself to work on building muscles until he looks like this. Now he has so many muscles he can't even wipe his own ass. So many women think they need to be the perfect Barbie doll, but Barbie was so out of proportion that this is how a woman would appear if they had those proportions. These are real women with implants that have gone to the extreme. They're never satisfied with the way they look. The lady on the right started as a B cup and now has a Z cup. They are in the Guinness Book of Records, but why? When health becomes an issue, you've gone too far. Eating disorders include bulimia and anorexia. Anorexia is an eating disorder which involves a persistent refusal to eat, even if the patient is hungry, and it's stemming from a psychological reason rather than an organic cause. They can also have a history of sexual abuse as children, but this does not mean that all anorexics had sexual abuse as children. However, if we try to fix the anorexia, and they actually did have a history of sexual abuse, then it will be very difficult to keep the anorexia resolved without also working on the other issue. Many anorexics report that they felt their life was out of control, and not eating was the one thing they could control. Often we also hear that they felt unloved. If you do not eat, you lose weight. Your body burns the fat first. And as an aside, have you ever heard the ridiculous commercials about lipozyme, which claim people who lost weight on their product lost mostly fat? Well, what else are they going to lose? How many people are manipulated by the stupid use of facts? Enough to keep people purchasing their product. Anyway, back to anorexia. When the body has no more fat to burn, it burns muscle. And your heart is a muscle. When it is desperate for a source of energy, your body starts to destroy your internal organs. An anorexic who has gotten this bad may be cured and gain weight again, but their internal organs are not going to be repaired. Karen Carpenter was a singer and songwriter with her brother in a band called The Carpenters. The Carpenters were the #1 best-selling American group between 1970 and 1980. Her voice was one of the best in pop music, and she went through 3 bouts of anorexia in a time when the doctor's cure was to basically slap you in the face and tell you to stop it and force food down your throat. Well, in 1983, Karen Carpenter died at the age of 32 from complications caused by anorexia. And these pictures show a deterioration from 1979 through 1982, when she did an interview a few months before she died. Anorexia was not understood as a mental disorder or issue which needed therapy to resolve. Although they were able to bring her out of the episode each time, the damage done to her internal organs was too great and she died as a result of the side effects of anorexia. Her family decided to let her image be the face of anorexia to help spread the word that this is a serious condition requiring both medical and mental intervention. Besides anorexia, we also have bulimia. Bulimia is another type of eating disorder, and it's characterized by eating binges followed by purges, or induced vomiting or laxatives. Bulimia is harder to see because bulimics will go out with friends and eat. Then they will excuse themselves and go to the restroom and throw up before the calories are absorbed. Or they could surreptitiously, before going out, take laxatives to get rid of the food before absorbing the calories. With anorexics, you do not see them eat and they lose weight, so it is fairly obvious what's happening. But with bulimics, it's not so easy to tell why they're losing the weight because you see them eating and they're losing weight. Purging takes stomach acid up the throat and into the mouth. That's vomiting, purging. If the bulimic purging continues over a long period of time, the acid causes damage to the esophagus, leading later to esophageal cancer. So you may fix the bulimia, but years later you can still see negative health consequences relating to the past experience. Also, their teeth and gums are badly damaged and their breath smells bad. It's just overall a debilitating disorder. The next disorder we will discuss is schizophrenia, which is a psychotic disorder involving distortions in thoughts, perceptions, and/or emotions, or moods. It is a split with reality. It occurs between 25 and 45 in women and before the age of 25 in men. 40% of all admissions, the inpatient admissions to mental health hospitals, involves this diagnosis. 1/3 of all cases never recover. Recover is a bad term because once you are diagnosed with this disorder, you have it on your record for life. You are never cured of schizophrenia unless we can figure out how to rewire the neurons in the brain, which may be possible in 50 to 100 years. So there are 4 different schizophrenic diagnoses. The 4 types are disorganized, catatonic, paranoid, and undifferentiated. When someone has no symptoms of the disease, they are said to be a residual type. Each of the types can also be either positive or negative in scope. Let's look at them all. The disorganized type features incoherent speech, hallucinations, delusions, and bizarre behavior. One symptom may be talking to imaginary people, and Jimmy Stewart played a schizophrenic in a wonderful 1950 movie called Harvey. He had a friend who was a 6'3" white rabbit. The rabbit went everywhere with him, and he had a place at the table for him and a place at the bar for Harvey. He even had a hat with holes in the top so Harvey's ears could fit through the hat. There is a video in this slide with one of my favorite lines from that movie, and I will post it as a link in YouTube so you can see that. The catatonic type involves a stupor or extreme excitement. In stupor, the person can be motionless for hours and even in rare cases for days. The stupor may mimic the petit mal seizure of epilepsy, where a person simply freezes as if they reboot. In the 2001 movie Don't Say a Word, Brittany Murphy faked catatonic schizophrenia to escape men who were trying to kill her. She felt safer in the mental ward of the hospital where they could not get to her, so the killers kidnapped the daughter of one of the psychiatrists to force him to get her out. He held up her hand and let it go, and she dropped her hand, and he knew then it was not catatonic state because in a catatonic state, then the hand would have remained exactly where it was when he let it go, so she was faking it. For a paranoid schizophrenic, the prominent feature is a combination of delusions and hallucinations. There are no catatonic states, and paranoia exists based on some illogical and unorganized delusion. Mel Gibson played a paranoid schizophrenic in the 1997 movie Conspiracy Theory, but just because you're paranoid doesn't mean that they're not out to get you. In Mel Gibson's case, his character was actually being hunted. Persons diagnosed with the undifferentiated type of schizophrenia display a combination of symptoms that do not clearly fit into one or the other of the different categories. So they have multiple issues that relate to all the others. Residual schizophrenia means that individuals who have had a past episode of schizophrenia are now free of the most extreme symptoms. These people are mildly disturbed, and emotionally impoverished. No one is ever considered cured once they have been diagnosed with schizophrenia. To show the absurdity of this refusal to say that a person is cured, a college professor taught his students to act like they were schizophrenic, and the students presented themselves at hospitals, and all but one was hospitalized with the diagnosis of schizophrenia. And once they were hospitalized, they stopped displaying the symptoms. They took daily notes about their experiences, and one nurse in one of the hospitals actually labeled the note-taking of one of these pseudo-patients as writing behavior, as if it was considered pathological. The challenge for the students was to get themselves released, and all of them were discharged. But they were discharged with a diagnosis of schizophrenia in remission, and all of them were forced to admit to having a mental illness and agree to take antipsychotic drugs as a condition of their release. They had all been tested prior to the experiment and found to be without any kind of pathology. Schizophrenia can be broken down into two other forms called positive and negative. The positive form is when a person displays active symptoms like the hallucinations or delusions. So, for instance, we can describe someone as a positive paranoid or a positive catatonic. The negative form of schizophrenia is defined as schizophrenia with deficits. For instance, a person may already be diagnosed with schizophrenia, but they are currently displaying deficits, such as a flat affect or mood. Remember, affect and mood mean the same thing. And this means that they have a dearth of emotions, both positive and negative emotions. They may have trouble starting or maintaining activity. They may appear lazy or seem unwilling to do the tasks of daily living, like bathing or dressing. But it is a symptom of the disease. They may not respond when talked to, or when they respond, it may be with a single word or a clipped sentence. I'm getting very close to my 15-minute limit now for each lecture, so I'll end this lecture here and begin again and talk to you again in lecture number 5.